Hi everyone, I want to talk about full anti-epileptic drugs that we can use to treat the different types of seizures disorder. Okay, let's go. If the diagnosis is absent seizures, the main drug is ethosuximide, and the side effects will be nausea, vomiting, sleep disturbance, drowsiness, hyperactivity, and agranulocytosis have been highlighted here. So if you are suspecting restless situation like ADHD and you are placing this patient on ethosuximide, watch out for hyperactivity again. Then agranulocytosis, you know the implication when it comes to infection. Stevens-Johnson syndrome or toxic epidermal necrolysis or aplastic anemia, hepatic failure, rash, dermatitis, or serum sickness are the possible side effects. If you are dealing with focal seizures, either focal without impairment of consciousness, which was formerly known as simple, or focal with impairment of consciousness, which is known as complex, or focal and secondarily generalized, then follow me to know the type of anti-epileptic drugs that will be suitable. Carbamazepine will be good here, but the side effects will include nausea, vomiting, diarrhea, rashes, and pruritus. I have highlighted Hyponatremia, Agranulocytosis, or Aplastic anemia, just to be able to focus on that seriously. Also, there's possibility of hypersensitivity or Stevens-Johnson syndrome, and there may be toxic epidermal necrolysis. Hepatic failure is possible, and pancreatitis, lupus syndrome, and hypogammaglobulinemia, on account of which the individual will be coming down with loss of infection. You can use Phenytoin here, and you are going to be dealing with gingival hypertrophy, rashes, confusion, and slurred speech. So if somebody is on Phenytoin for a long time and the individual is having slurred speech, don't bother yourself going into full details of neuro except you suspect otherwise. It might be as a result of Phenytoin usage. There's likelihood of double vision or ataxia. Just like carbamazepine or ethosuximide, you can have agranulocytosis or aplastic anemia as well. So it's also possible that you have hepatic failure, Stevens-Johnson syndrome, toxic epidermal necrolysis, serum sickness, and note this, neuropathy. So someone is diabetic and is on Phenytoin, double neuropathy. Hirsutism, yes, to those who have alopecia and they're on Phenytoin, that might be a gift. Pseudolymphoma, lupus syndrome, and adenopathy. Gabapentin will also be good here, but I'm going to deal with dizziness, ataxia, somnolency, and multi-organ hypersensitivity. So gabapentin is very safe once there's no hypersensitivity to the organs. You can use lacosamide, also very nice. We are going to deal with only fatigue, nausea, vomiting, ataxia, dizziness, headache, and of course, diplopia. Phenobarbital and primidone are good, but you'll be dealing with rashes, nausea, sedation, lethargy, changes in behavior, alteration of sleep cycle, and agranulocytosis, Stevens-Johnson syndrome, toxic epidermal necrolysis, hepatic failure, and watch this, Dupuytren's contracture. So in an individual that is European or is having diabetes mellitus coming down with Dupuytren's contracture and is on phenobarbital and primidone, that might be caused by phenobarbital or pyridine. Hyperactivity is possible here, and ataxia. Tolerance is possible, and dependence is possible. You can use pregabalin, and here you're going to have weight gain. So someone who needs to lose weight, and you place on pregabalin, you might be adding to the problem. There's possibility of dry mouth, peripheral edema, dizziness, ataxia, tremor, hypersensitivity that may lead to Stevens-Johnson syndrome, toxic epidermal necrolysis, or angioedema. So when you are placing anyone on pregabalin, it's going to be expedient to know what the hypersensitivity reaction will be, particularly at the beginning of the medication. Rhabdomyolysis is possible here, so you're going to watch the renal system to know what is going on. You can use vigabatrin, and anyone on vigabatrin is likely going to be dealing with visual loss, drowsiness, fatigue, and dizziness. And something is abnormally strained here. There's going to be magnetic resonance abnormalities in individual that's on vigabatrin, depression, and weight gain. Tiagabine will give abdominal pain, nausea, decreased concentration, dizziness, low energy, tremor, and nervousness. As the carbamazepine will give nausea, vomiting, diarrhea, fatigue, and hyponatremia. Possibility of rashes, headache, vertigo, or vertigo. Vertigo is not only in elderly or somebody having neurological disorder. Just find out, is this the type of anti-seizure medication that the person has replaced upon. Also can be dealing with broad vision and tremor. And with that, I've come to the end of medications that you can use for focused seizure treatment and absent seizures. So I'm going to talk about all other types of seizures and the medications that's going to be used next. So kindly subscribe to my channel so that you can get these presentations immediately they're published. Thank you.